Good evening, everybody, and welcome to the Kimmelman Bar Mitzvah. You know, I do so many of these, I forget where I'm at. I need the glasses at this point. Thank you so much for being here, and thank you for having me here. So nice to have you all, and so nice to be here tonight. For those of you who are saying, wait, Rosado with a T? How is that possible that he is Latino? My mother is from Argentina. Eso es porque puedo hablar español también. Y speak Spanish. ¿Cómo es posible? ¿Sí? Pero toda la gente que trabaja a Canal 7 me dice siempre, no puede hablar español cuando trabaja a Canal 7. Ese no es Univision. Ok, tal vez eventualmente va a ser Univision. For those people who don't speak Spanish, all the years that I worked at Channel 7, they would say, all right, we will not speak Spanish on the air because this isn't Univision. And I would say, okay, fine. Well, eventually this country will be Univision. And by the way, this past year, we actually signed an agreement with Univision. So now ABC and Univision are actually co-owned about 15%. Starting this fall, we have a new cable network that we began, or will begin. And it's sort of a Spanglish cable network for all the children of Spanish speakers who kind of speak a little Spanish and a little English. And so the programming literally will be what I'm doing right now. So las personas que hablan para la estación van a hablar un poco de español, and they'll speak a little English. And it's for those people like us who understand a little bit. So hopefully this fall you'll look for it. We actually haven't named it yet. But I'm sure you'll be reading about it in all the newspapers, so look out for it. And you heard it here first, okay? Yes. So thank you. And I'm hoping I'll do that part-time too. But now you know. So my mother's Argentinian, my father's Italian. That makes me very, very confused. Because we all know Italians and Argentinians are not very stubborn or anger-filled people at all. It is, as I mentioned, a great honor and pleasure to be with you here. I've been with Channel 7 now. This is my 11th year, and we've been blessed as being the #1 local television station. Actually, since my 17th year, we're #1. What the hell did we do to deserve that, God? Thank you. The people at Channel 5 right now are saying, why? They're pretty good. They're pretty close. Channel 4, that close, but Channel 7, thank God, we keep skirting up there, and we appreciate it. Thanks to you folks watching. And but I gotta say, you know who keeps skirting up there, and who actually was #1. You know what, the folks at that table right there. It's always the people in the corner. Always the corner. I should mention the TV station who has the most adult viewership, 25 to 54, which is the key demographic that advertisers look for, is Univision. So that says something. The largest group in the United States, as we all know, for the last couple of years, of ethnics, as we call them, is Hispanics, Latinos, 51 million. Like I had something to do with it. I went around from household to household, and I had something to do with it. And all the dads and granddads are very angry with me right now.
You're the messenger.
Just the messenger. No, 51 million people claim to have some kind of Latino or Hispanic heritage in the United States, out of 306 million in the United States. That's huge. That says an awful lot. And right now they're working on immigration reform, and that will say a lot more in the months to come, I'm sure. So just think about what that can mean in the years to come. You know, this is a huge group of folks. We all are a huge group of folks who represent a lot. And the other thing to consider, and why we're here tonight, that Hispanics as an ethnic group represent the largest ethnic group that claim to have university and education among them. So in terms of education, university, college, of any ethnic group, you know, we'll starve ourselves in order to make sure our kids get to school. You know, and that doesn't. And by the way, that does not take away from any other ethnic group, because I know plenty of folks who are Asian and who are black who will also starve themselves to make sure their kids get to school. I work with Lori Stokes, who has worked very hard to make sure her kids get to school. But it just statistically works out that way. But it's an amazing fact right now. So we should be very proud of the fact of the group that you're from. Latinos are an amazing and very diversified group, and we're not monolithic. We're black and white and brown and green and purple. That's the thing about Latinos. The one thing we share is just a language and family values. And we come from all these wonderful countries and come to this awesome country, and we share that love and the family and great food too. Boy, don't we have good food. Well, anyway, enough of that. Enough about that. We move forward. We're here to honor a wonderful person tonight who happens to be at the table that I'm sitting at. And the one thing about the organization that I want to just leave you with, it is so important that we recognize, as the healthcare industry is changing pretty radically, that we recognize Hispanics in healthcare. Don't forget, as Hispanics represent the largest ethnic group in the United States, largest minority group in the United States. Oh, did I forget to mention that? Oh, I'm sorry, I forgot to mention that. And you know, my dad, the Italian side of the family, they used to say growing up that Italians, my dad used to say, Italians were the largest. About that, shh, it's now mom's side. Quiet. So now dad stays quiet at the dinner table. Mom likes to say, si, mira, ahora, silencio. Finally, the Argentinians went out of the Italians. That now, as we move forward, 51 million and growing in the United States, that it is important, finally, as healthcare is radically revamping itself and redefining itself, that there be an organization that so represents Latinos in this important field. So let us move forward. Ladies and gentlemen, please stand for our national anthem and invocation.
Annual Healthcare Diversity Awards. The organization has been around now 15 years, and that's no small thing, particularly this year, that it was an extremely year for certainly most nonprofits, and we were in that same category. As Ken indicated, healthcare is going through a major resizing and upsizing, and it's just changing completely. And part of this is the unknown, not knowing what's down the line and the impact of what's going to happen. So we certainly know that it's going to embrace and ensure millions of new individuals in health insurance, and that's certainly a very positive thing, and we appreciate that.
Luis Vasquez, who is the chairman of the National Hispanic Chamber of Commerce, the 2013 Awards Chair. Come on up.
Muy buenas noches, I'm back. Are you having a good time? How's the wine? I'm a little tipsy here. Casa de Vinos in the house, anyway. I just want to say thank you. The most important part, the program is going to be great, but I think, and I say the most important because now we're going to thank the sponsors because that's where we get the checks from. Thank you very much. En español, muchas gracias por su apoyo a todos. Let's give these guys a great hand. Let's give the sponsors a great hand. They make us do what we do in our vision and our mission. De parte de la Cámara de Comercio de Salud y de parte de AGE, muchas gracias por estar con nosotros esta noche. Para nosotros es un orgullo tener latinos en la rama de médico, en la rama de salud, y para nosotros es un orgullo darle honor a toda esta persona importante. Hoy tenemos también, gracias a Ken Rosado por estar con nosotros. Cada siempre un aplauso a Ken Rosado. Y también tenemos a los honorees y también el comisionado del Estado de Nueva York, el comisionado Shaw. The great thing that's going to happen today, the great thing that's going to happen, he's going to make his presentation in Spanish. He said, yeah. Un aplauso. Thank you. God bless you. I'll see you. Have a great night. Gracias.
I like that picture. I had a lot more black hair back then. I gotta get a copy of that. So I understand I am what is standing between you and dinner. So instead of these 30 pages, I'll try to distill it down. But I did hear that the wine is still flowing. So please make sure your palms are full, your glasses are raised. How many folks in this room were either born in a different country or their parents were born in a different country? Most. Good. Fantastic. Well, you know, we are the future of America. I'm sorry for those of you who didn't raise your hands, but myself, my kids, you know, immigrants, we are the future of America. We are the best and the brightest of our home countries, and we are contributing to a great vision for a great country in our adopted homes. We have not forgotten where we've come from. We will never forget where we came from, but we will make America greater because of what we do. And that's what AHI is doing. I don't want you to stand there the whole night holding that. Do you need to give that? Put that down if you want. She's holding a nice piece of glass. It's a little dangerous, so I don't want her to get hurt. I'm going to start tonight with a little story. You know, back in 1997, on a Saturday morning in Tokyo, around 4 in the morning, 1997, there was a fire, a big fire, in the Aisin Seiki Toyota Manufacturing Plant number 1. Why do we care? Well, that one plant made a $5 part, and that $5 part was something called a P-valve. Every car made needs P-valves for their braking system. And without that P-valve, even if you have all 20,000 other parts of the car, you cannot make a car. That one plant made all of Toyota's P-valves. 14,000 cars a day stopped being made when that plant burned down. 14,000 cars a day. And there were not just one kind of P-valve, there were 200 variations of P-valves being made in that plant. Experts said it would take 6 months to rebuild that factory. 6 months, what a toll on the Japanese economy. But it didn't take 6 months. Cars were rolling off the Toyota assembly line in 5 days. How did that happen? It was not a miracle. It was because Toyota, with their 36 suppliers and 50 parts manufacturers and all these other folks who worked with Toyota to build cars, heard about that fire that Saturday morning, and before the embers had even cooled, before the fire had fully been put out, all of these people, all of these companies started faxing P-valve specifications back and forth to each other. They figured it out on their own. There was a sewing machine manufacturer who retooled over 500 hours and started making P-valves 1, 5, 10 at a time. And so that by that Thursday, trucks started rolling in with P-valves from all over, meeting the greater good of Toyota. And that was not because Toyota had a command and control infrastructure. They didn't say, we need P-valves, you do this, you do that, you do that. It was exactly the opposite. It was an ecosystem. An ecosystem of suppliers, of distributors, all working for the greater good, the resiliency of the organism that was Toyota and its parts. And today in healthcare, we have absolutely nothing like that. We are the opposite of an ecosystem. And that is the problem. You know, we still think of, let's serve our patients. Well, what does that mean? It means that I care for you when you show up in the four walls of my hospital. Goodbye, good luck outside the four walls. Okay, let's evolve. Let's not call them patients anymore. Let's call them customers, right? Customers. That means I am thinking of you beyond the four walls of the hospital, not just as patients, but as customers. But that still means when you have customers, you have a product. What exactly is the product of our $2.7 trillion healthcare system? What are we selling? More CAT scans? More MRIs? More opioid painkillers? Well, I don't know about you, but those aren't products I want to buy. They did a survey of healthcare CEOs, and 43% of healthcare CEOs in this PricewaterhouseCoopers survey said that they were interested in improving customer service. 78% said that customers have a significant influence on their strategy. Why aren't those numbers 100%? What about the other half of those CEOs? They don't care about their customers. Shouldn't it be customers who influence healthcare? So now we're moving away to the next evolution where we've talked about patients, we've talked about customers. Let's talk about clients, because clients means service. Healthcare should be a service industry. And yet, that doesn't really get to the heart of the problem. It's not just about service in the healthcare setting. When we still talk about service and healthcare delivery, our healthcare delivery system is perfectly designed today to do what it's supposed to do, deliver healthcare. It's not designed to deliver health. What do we want? I don't want healthcare, I want health. That's why our $2.7 trillion, a third of it is wasted every year. 18% of our GDP goes toward this. 6% is wasted every year because it's delivering health care. And we don't want health care, we want health. And that's the conversation we're trying to have in New York, and we've had for the last 2 years. And it's important because when we start talking about health instead of health care, we ask very different questions. And when we ask different questions, we get different answers. How do you maximize the health of a community? That's the question I want to answer. And that doesn't always come, the answers don't come from the healthcare delivery system. In fact, most of the answer for how do you deliver better health comes from outside. If you look at a pie graph of where does health come from, 10% of health actually comes from healthcare. From the medicines that we take, from the doctors that we see, the tests, diagnostics. Only 10% comes from the healthcare delivery system. 90% of your health comes from whether you took the stairs up, whether you choose to eat that donut, whether you choose to smoke a cigarette, where you live, where you went to school, what job you have. These are all the social determinants of health. That is a very important concept. Health comes not from the healthcare delivery system. It comes despite it. It comes from everywhere else. And that's what NIAM and others are teaching us. That the social determinants of health are where we need to focus our energy, our money, our efforts, our full attention if we want to eliminate disparities. I have a lot of numbers, and I'm going to try to keep them brief because there's just too many and it's depressing. In New York State, Hispanic Americans are the largest minority group. We now have more than 3.4 million Hispanics living in New York, more than 3 times the number of the state of Delaware, more than 5 times the size of Vermont. And yet, Hispanic Americans face the biggest disparities. For one, about 60% of Hispanics in New York die prematurely, which means they pass away before the age of 75. And compare that to 34% of white non-Hispanics. Hispanics are more likely to die of asthma, diabetes, HIV/AIDS than their white non-Hispanic counterparts. As a group, they're at higher risk for all of these. Hispanic preschoolers in the state's Women, Infants, and Children's program have the highest rates of obesity, the next public health emergency facing America. Hispanics report the highest percentages of poor health and poor mental health compared to other racial and ethnic groups. And at the same time, Hispanic Americans are also more likely to be uninsured. In fact, they have the highest rates of uninsured rates of any racial or ethnic groups in the US. In New York alone, 1 in 4 of the state's Hispanic population has no health insurance today. That relates to those outcomes. The Affordable Care Act looks to eliminate those disparities. By giving insurance cards, then the only point of entry will not just be the emergency room, but it will be in the primary care doctor's office. It'll be about prevention. It'll be about getting health care to help you stay healthy, not just when you're already sick and need to only go to the hospital. And thankfully, under the leadership of Governor Cuomo, New York has been a leader nationally in advancing access to care. You know, this is actually a very big deal. On October 1st, we will be ready to open the doors to our health benefits exchange. One of 17 states, but really one of the only big ones that really matter in terms of opening up their own exchange. And this will give insurance cards and prevention and the promise of health to 1.1 million New Yorkers over the next few years. But as Hispanic Americans get insurance cards, there will be more demand for Hispanic Americans in the healthcare workforce. A huge demand. And we need to figure out together how to get more Hispanic doctors, Hispanic nurses, Hispanic dentists in the system working so that when you show up, you see someone who looks like you, who understands your culture, who can speak Spanish. You know, I'm sorry, I took French, Latin, and German, and those are the 3 biggest mistakes. I never took a language that mattered. But, you know, we love our diversity in America, but we need the healthcare system to reflect that diversity, and we're counting on you to help us along those lines. I mean, this is your group's mission, and our group's mission is to support your group's mission. You know, we do things on the margins. We've given $1.7 million to the Associated Medical Schools of New York to encourage minority and economically disadvantaged students to pursue careers in medicine and the health professions. You know, one of these programs is at the University of Buffalo, and it's been around since 1990. We've got hundreds of students to go to medical school who might not have ethnically diverse, racially diverse students. And we're trying to support those kinds of programs from early ages, from middle school, through high school, through college, all the way up, so people can see the vision of being a doctor in healthcare. You know, I have severely disappointed my parents because I never did win that national spelling bee. But despite that, you know, I was either doctor, lawyer, or engineer. I made it into one of their categories. We need to have those same aspirations, not just for Indians, but for Hispanics. We need to have the same pathways, the same leadership, the people. You are the mentors for those next generations. That's what it took. That's what it takes. It's breaking those barriers. And you know, we've done it pretty well. I think Asians are way too overrepresented as doctors personally, but that's okay. We need to get more Hispanics into healthcare. You know, I'll tell you 1 or 2 more stories. You know, I'm thinking in particular of the experience of Anthony Paradise. Anthony, who's 24, is now a second-year medical student at SUNY Upstate in New York, currently doing gastroenterology research. Anthony's parents came to the US from Ecuador in the mid-1970s and early 80s. They spoke very little English. His grandfather who joined them spoke no English at all. And like many immigrant families, including my own, they arrived here with big dreams for their children, hopes for a better life. They settled in Corona, Queens, which has a large Hispanic population, And one day, when young Anthony went to a community clinic with his mother, he encountered a room completely packed with patients. They sat down and waited and waited. In all, they waited 3 hours just to see one of the Spanish-speaking doctors. Young Anthony asked his mother why there were so many people in the waiting room. And his mother said that there were not many doctors in the community who spoke Spanish, who could understand their customs and culture. And all of these people were waiting to see that one doctor who did. That conversation had a lasting impact on Anthony, who loved science, had a knack for it, went down to Syracuse University, got a scholarship in the state's post-bac program. As an undergrad, he did volunteer work at SUNY Upstate Medical Center. He remembers one day seeing an older man struggling to talk to his doctor. The man spoke Spanish, clearly frustrated and frazzled when he couldn't communicate his needs. Anthony stepped in, translated for the patient, and Anthony realized then and there that he was going to play an important role in medicine, not just as a doctor, but as someone who was going to bridge that big divide between that Spanish-speaking patient and their doctors. Anthony's older sister, Linda, enrolled in medical school for the same reasons. And at the age of 9, she accompanied her grandfather to his doctor's appointments and helped translate information about taking care of his diabetes. It was a big responsibility for a 9-year-old. And yet, today she is a 3rd-year medical student in the Caribbean with the goal of becoming an anesthesiologist. And Anthony's older brother, Angelo, he's graduating tomorrow from Walter Reed Medical Hospital, where he just completed his fellowship in gastroenterology. 3 children those parents had, 3 doctors. Their parents must be proud. We need more people like Anthony, Linda, Angelo, Hispanic Americans who are willing to come forward and embrace the health profession, despite the challenges, despite organic chemistry, which is the bane of everyone's existence. You know, an old proverb says, if you want to go fast, walk alone. If you want to go far, walk together. Let's walk together for the greater good. Thank you.
So, we know now it's dinner's time, but that's it. Good job. We want to present Dr. Shaw now, not only in recognition of his time, support to be keynote speaker this evening, but in all the initiatives that he's provided to provide a healthy New York and nominate him as our Health Advocate of the Year. Thank you. Okay, now we'd like to get into presenting our major awardees of the evening. And as always, I know that you will respect them by giving them your full attention as they give their brief remarks. The first individual that I would like to ask to come to the stage is Dr. Bernie Fernandez Jr., President of the Cleveland Clinic, Florida. And to introduce Dr. Fernandez and to award him our first National Hospital CEO of the Year is our good friend Raymond Arroyo.
I already spoke about how much I admire Bernie Fernandez. He's not just one of those executives who sits on top of the buildings and doesn't talk to anybody. He is a real doer, a real friend, a real executive, cares deeply about the community, deeply about the Latino community, specifically in South Florida. And I'm just delighted, elated to present to him the CEO of the Year award.
And thank you very much for this great honor. So I'm going to follow the words of Franklin Roosevelt, who said, when you're going to give a speech, be sincere, be brief, and be seated. So thank you, and I want to thank my wife, who's been a great partner in my career. And also to great supporters that followed me all the way up here. That's how important this award was to me. My brother-in-law and sister-in-law Maria, and colleagues. I think that Commissioner Shaw said it very well. Healthcare is a team sport. And I accept this on behalf of all my colleagues, the people that really take care of their patients every single day. The nurses, the doctors, the technologists. And I thank you all for this. And let me leave you with just a quick thought, as Quincy Adams said. If your actions inspire others to dream more, learn more, and do more, then you're a leader. Keep it up, because we need to be part of the conversation. Thank you.
Excuse me? To borrow a phrase from the former speaker, Tip O'Neill, who said, this isn't was old politics is local. So when we really look at how we do implement change, the change comes locally. And for us, that means in the community. So it's my pleasure this evening to present the award for Community Health Executive of the Year goes to Elizabeth H. Swain, the President and CEO of the Community Healthcare Association of the Year. Ms. Frank.
Thank you so much. It's one thing I want to say is you folks really know how to party, and you know it's wonderful to be here. I am honored to be the recipient of this award this evening, Community Health Executive of the Year. Incredibly important. Focus on the community. Congratulations to my fellow honorees, Dr. Shaw. It is wonderful to be sharing the spotlight with you tonight, and you are an amazing and innovative spokesperson for what's really important in public health in this country. I run an association of community health centers across the state of New York, and we take care of. Last year we took care of 1.6 million New Yorkers, providing high-quality primary and prevention programs to people who live in underserved communities across the state. And it's such a privilege tonight to be representing those people in those communities. So thank you so much.
Thank you, George. So I have the honor of reading Lloyd Cosby's bio. Founder and principal of Arcos Communications, Lloyd Cosby has been the chief strategist behind the creation and execution of public relations, marketing, and public affairs campaigns that reach the hearts and minds of multicultural consumers. He maintains membership in a number of professional organizations and serves on local nonprofit boards, including... Hello? Do we have a bid here for the $3,000 for the, oh, okay. So that's professional organizations that serve on local nonprofit boards, including the world-renowned Jose Limon Dance Company and the Bronx Works. He earned. Oye, pero ¿qué pasa ahí? Hello? Hey! Hello? Who's bidding $5,000? Speak up. Por favor, I'm almost done. Oye, table 15, por favor. Okay. Our local boards, including the world-renowned Jose Limon Dance Company and Bronx Works, he earned the Master's in Public Administration from the John F. Kennedy School at Harvard University and his Bachelor of Arts degree in the Psychology from Yale University. That deserves thank you. I make the pen.
Thank you. I'm actually going to run through our agency capabilities presentation right now. No, I know I'm the last honoree here, so I don't want to stand between you and the rest of the evening, but it gives me a great honor to receive this award from the Association of Hispanic Healthcare Executives, and I'm humbled and proud to receive it on behalf of Audibus Communications. Of course, I have a lot of people to thank in this room. It feels a little bit like a Lifetime Achievement Award for me. I have something in common with Dr. Shah. That picture I had taken maybe at the beginning of when I started my agency. Now I have a few more gray hairs. But I know many of you in this room because I work with you. And I really want to thank so many of you for the opportunity to learn so much from you about health and how to take care of patients in our community. And we've learned a lot from you, and our success is due to many of you. I've worked with the health heroes, the likes of Paul Ramos, who founded the Betances Health Center on the Lower East Side, Paloma Hernandez from Urban Health Plan, and I especially want to thank my very good friend and dear friend, Guillermo Chacon, from the Latino Commission on AIDS. The commission is our oldest client. We've been with them since the beginning, even before Audibus Communications, because I was working with them as an independent consultant before I started the agency. So all of the 18 years that I've been in this field, I've been working with the commission. And I've also worked in collaboration with the National Hispanic Medical Association, Dr. Elena Rivas, National Association of Hispanic Nurses. So again, I really want to thank you all, and I want to thank my good friends at Pfizer, Tasha Holden, who is here from Pfizer Health Answers, and Dr. Puente. We've also had a very long association with your company for the last 10 years, and we could not have done this without you. And I, of course, could not have done it without the support of my staff. Dina Vanessa, who is here representing our staff, and Jai Vargas, who was here also and was part of our history. Again, we're in a very critical time, a very changing time, as many of you have said, about health, the health industry and health reform. But we stay committed to helping you, and please rediscover us, as our ad says, because we recently changed our brand and we're changing with the times. So we want to innovate and create, keep creating. I'm certainly not done. ARCOS continues to evolve. So thank you so much for this honor.